We want to say a big welcome to you. If you're a returning viewer, um, we want to send you a warm hug and a big shout out to you. You know how we do it on the show. Click on the like button, click on the subscribe button, click on the share button. Our session today is going to be very, very informative and educative. It's important that everyone around you gets to hear about what we're going to discuss today. Stay glued to your screens, and we promise that it's going to be informative. My name is Abimajelio Jo Grace, and I'm your host for today. I am live in the studio with our very own Dr. Debbie Olibi. You're welcome, ma.
Thank you very much, Grace.
It's
Happy
good to
to be
have you
here.
here.
Thank you very much. I'm happy to be here. Good afternoon, viewers.
So, from our last session, we talked about the different types of cancer and the treatment that may impact fertility. We talked about the potential long term effects of cancer treatments on fertility. Talked about we talked about a lot of things that has to do with fertility and cancer. So today we fused in some questions that were asked by real people who were diagnosed with cancer and who had concerns and wanted to find out from their fertility specialists what their chances were, or they just wanted their anxieties to be allayed, or and to find out solutions to their problems. So today we enjoin you to sit put and learn from today's session because it promises to be informative. I'm sorry, please. It promises to be informative. Dr. Debbie, you're welcome once again.
Thank you very much.
So we'll start with our first question. Like I said, these questions were asked by real people.
Okay.
After a diagnosis of cancer, how long do I have to make a decision about fertility preservation before starting cancer treatment?
Okay. Thank you for that. So it depends on the kind of cancer,
Cancer
depends on the stage of the cancer, and then what your healthcare provider, in
provider
this case, the oncologist, feels the treatment
option
timeline should
should be
look like.
okay.
But I'm sure the client can, make their own inputs to say what they want. So depending on if this is a rapidly growing
Growing
cancer,
cancer,
there are some cancers that are more slow growing than others, and then the stage at which the
which
cancer
cancer
was
is
detected, that would determine how soon they want to, start treatment. If you're talking of your how long you can wait before you try, you take a decision about your fertility. Are you talking of getting pregnant and then going through the 9 months? That's like looking at a year. Most cancers, I don't think they want
can't
to
wait that
wait that
long.
long. Yes. So the options you have might be things that could help you preserve your fertility in that little time you have before you commence treatment. So things like maybe freezing your eggs if you're a woman, freezing your sperm if you're a man. You could even be freezing the embryos. So you could have an IVF quickly, eggs could be retrieved, they could fertilize your husband's sperm, and the embryo is frozen for
Okay.
you to use at a later date.
Okay. Thank you very much. Then the next question is, can I still have fertility preservation if my cancer treatment needs to start quickly? I think you kind of
Yes, and
answered
yes. So the
answered.
kind of fertility preservation you can have would depend on the kind of cancer, the stage, how fast growing it is, and what your caregiver feels should be the timeline for when you should start treatment. So you will all be in a conference, and then you come to
Make
a
a decision.
conclusion. Yes.
So during the last session, we talked about what fertility preservation is and what options are available for men and women before, during, or after cancer treatment.
Okay.
So what is the success rate of each method?
Okay, so the major fertility preservation methods we have explained in our region, or where we practice, are freezing your eggs, freezing your sperm, freezing the embryos. In other places, the organ can even be
Frozen.
frozen. Yes, the organ can be frozen. So based on the methods we have, you know before, most of them can be done before the treatment commences. I think that's the best time to do it, before you have your cancer treatment, because we know that a lot of cancer treatment can lead to
So,
damage to these reproductive
organs.
organs, and a lot of cancer treatment can damage, reduce your fertility prospects in future. That's some of the long term side effects of cancer treatment, be it radiation therapy, be it chemotherapy,
Okay.
and so on. Some of them can lead to those, complications in future. So the best time, I think, is before you have the treatment. Your eggs could be stored, could be frozen and stored. The sperm could be frozen and stored. So I think
Okay.
that's, and then after cancer treatment, say for example, for someone that didn't know that these options of preserving
Existed.
fertility are available, and then you've had your cancer treatment,
Treatment done.
you've been cured or the cancer is in remission, and you're now trying to conceive and it's becoming difficult. So IVF is an option for you. Surrogacy is an option for you.
Hmm.
Yes, at that time.
So moving on to the next question. Can pregnancy raise the risk of cancer reoccurrence in a woman?
Okay, so pregnancy has not largely been shown to affect,
Cancer reoccurrence.
cancer in any way, as in either
Reoccurrence.
increasing the chances of reoccurrence or even worsening the cancer. But it's just that pregnancy, a woman that is pregnant, it makes cancer diagnosis and treatment a bit more difficult.
Difficult.
Yes, because depending on where the cancer is located, because of the growing uterus, it
Mm,
might be difficult to palpate these abnormal masses in some part of the pelvis because the growing uterus might be masking them. And
mm.
then treatment, because now there's a fetus, so you now
Involved.
have to outweigh,
The
weigh
advantages and
exactly, because you now weigh the options. How fast growing is this cancer? What's the risk to the woman's life?
yeah,
And is it the kind of cancer that you can wait till she delivers before you commence
common
treatment?
treatment
So all those things will be weighed by the healthcare provider,
provider.
and even the woman. She will make but largely pregnancy doesn't impact on the outcome of cancer. But we know that pregnancy is a high metabolic state, and
Mm.
cancer too is a high metabolic state. You have cells growing rapidly.
Reproduction.
Yes, so pregnancy, cancer treatment can also impact on the pregnancy. Some of the cancer treatment can lead to damages to the fetus, causing
Mm.
congenital abnormalities and so on,
Mm.
neural tube defects and so on. So that's why pregnancy with cancer is a challenging situation. Sometimes they choose to sacrifice, the fetus with respect to the mother's life.
Mm.
The mother's life is usually paramount, but she's an entity and she can decide that, she wants her baby first to be considered
Mm.
first before
First.
her. But medically, ethically,
Speaking.
based on ethics, we will want to consider the mother first.
Okay. Moving on to the next question. If I want to try to get pregnant after treatment, what is the recommended waiting period?
Okay, so the recommended waiting period would depend on the kind of cancer,
Mm.
the kind of treatment you had. Yes, because many people want to be sure the cancer is cured or you
Cured.
are in remission.
Remission.
Yes, before you consider fertility. But I think for most, waiting for about 2 years will not be too bad, so that your body, as we know, cancer
And
treatment
recover.
causes a lot of damage even to normal tissue.
Mm.
You're trying to kill the cancer cells, but normal tissues
Tissues
are
are
also destroyed in the
destroyed.
process. Yeah, so you want the woman to come back to as near normal as possible before she embarks on a
Journey of
journey of pregnancy,
pregnancy.
because pregnancy also takes a lot from you.
Okay. Thank you, ma.
You're welcome.
So, what are my chances of conceiving naturally after my cancer treatment?
So your chances of conceiving naturally will depend on the kind of cancer. For example,
Mm.
if you had ovarian cancer
Mm.
and the ovaries had to be removed,
Moved. Mm.
or you had treatment like radiotherapy that damaged the ovaries or even damaged the endometrium, the uterus, or you had cervical cancer that the cervix had to be removed, all this would impact on if you can have conceive naturally or
Naturally or
even
not.
carry a pregnancy to
To
term.
term.
Yes, so it will depend on the kind of cancer and the kind of treatment you had. Yes, but for most cancers that maybe are not in the reproductive tract, you might still be able to, carry a pregnancy to term, conceive naturally and carry a pregnancy to term.
Mm.
Yeah, but the kind of cancer, the treatment you had will determine if that will happen.
Okay, so the next question is: are there any risks to me or the baby if I get pregnant after cancer treatment?
No, if you're cured, you're not on the treatment currently. There shouldn't be any risk to you or the baby.
Okay.
There shouldn't be any risk to you or the baby.
So the next question is: if I am unable to conceive naturally, what are my options?
Okay, so after cancer treatment, like we said, some of the long-term complications of cancer treatment is, affectation of reduction in fertility, because cancer treatment could lead to premature menopause,
Mm.
premature ovarian insufficiency. The ovaries are damaged, the uterus could be damaged, the endometrium could be damaged, could lead to poor sperm production, the testicles could be damaged depending on the kind of cancer and the kind of treatment. So options might be, if you've tried, to conceive spontaneously, the option will be to go for assisted fertility treatments. And this might involve having an IVF treatment.
Okay.
Now, look at IVF treatment. There are various kinds of IVF
Hmm.
treatment. Sometimes this might involve using donor gametes, either donor eggs, donor
Hmm.
sperm. Sometimes you might even need a surrogate
Hmm.
to help you carry this pregnancy. So those are all the options. There are still a lot of options to conceiving if you're not able to conceive
Conceiving it on your
spontaneously.
own.
Yes.
So our next question is a woman at risk of developing complications during pregnancy, labor, or delivery because of her cancer treatment?
Not necessarily. No, though some forms of cancer treatment could increase the risk of you having some complications. For example, a woman that had maybe cervical cancer and the cervix had to be removed, that kind of woman might not be able to deliver. She might not be able to carry a pregnancy because the cervix is now incompetent. Yes, they could put a cerclage, and for that kind of woman, she might not be able to have a vaginal delivery.
Delivery.
She will have to have a cesarean section. So it depends on what was exactly done. If the reproductive organs are still
Yes,
in
good.
their normal state, she could, still deliver. She might not have any complication. But from form of cancer treatment could also give rise to adhesions. Maybe she had radiotherapy, there could be adhesions and so on. So that might, make her have some interventions that she would not naturally have had. So I think that's the way that cancer treatment can impact on pregnancy, but it will depend on what kind of treatment she had, where was the cancer, what was done. Because if her uterus has been removed to preserve her life because of the kind of cancer she has, definitely that kind of woman can carry a pregnancy. So she might have to think of surrogacy in that instance.
Thank you, Dr. Debbie. Before we move on to our next questions, would like to inform the our viewers that if you have any questions that we have not touched, if you have things that you are pondering on that we have not touched during this discussion, you can send us a message on our chat boxes and we'll discuss them here if we can, and if not, to respond to you online. So we'll move on to the next question. Um, when would you advise genetic testing to be done to look for hereditary cancer genes that an individual can pass to the child?
Okay, so you cannot pass cancer to a child, but the child could inherit some genes, some mutant genes that places them at a higher risk of
Risk.
developing some cancers. I know there's one. I think she's an actress, Lina
Angelina Jolie.
Jolie, yes, that had a double mastectomy because she had BRCA1 and BRCA2 genes.
Mm,
Breast cancer ran in her family,
mm.
and when she was tested, she
She
discovered she had these genes. So that means she has an increased risk of
of
having breast
having it.
cancer. Though there are other factors that will predispose to you eventually having the breast cancer, like lifestyle, environmental factors, not just genetic factors. But so she took that decision and had both of her breasts removed. Yeah, so I for people that have cancers that run in their families,
Family.
yes, and cancers that have genetic links, cancers that are due to inheriting some abnormal genes, mutant genes, I would advise, if you can, it's good you have genetic screening done,
Done.
yes, so that it helps to quickly detects that you have these genes, so that early screening can be done routinely, preventive measures can be put in place, and then
Mm,
when the diagnosis is made, if it happens that you get the cancer eventually, early treatment can be instituted. So it's something that should be encouraged. If you notice that there's this family pattern of certain cancers in the family, and there's a mutant gene that's been linked to them, it's good to have that genetic testing done.
mm. You said something about Angelina Jolie, and for me, I would say she's really a bold woman.
No,
Not everybody
she
could
took
have gone
the
through a
bull by the
radical.
horn. Yeah, that was a very radical
even
decision.
as even as I am seated here, I don't know if I would want to do that. So my
Because yeah,
question is, there are people who might have these genes and are not bold enough to go for the radical, are not ready to take the bull by the
the
horn,
horn.
like you said. Are
Yes.
there other options for them
Yeah,
for
so
treatment?
okay, so if it is cancer that we have a screening test for, like cervical cancer, there's a screening test. So you even before most of these cancer screening, there are recommended ages
Yes, yeah.
for when you should start doing them. So for that kind of person, you start much earlier. And then, if it's breast cancer, self breast examination,
Examination.
you start much earlier and so on. So that's what I'll just advise for that kind of person. You start screening earlier
Earlier.
than the recommended time, for the normal population, since you have a higher risk of getting that kind of form of cancer.
Okay.
Yeah.
Thank you very much, Dr. Debbie.
Thank
Do
you,
you have any
Grace.
final words for our viewers?
Yeah, so I just want to say that, cancer is not the end of life. Yes, it's not a good diagnosis. It's bad news, it's not nothing anybody wants to hear. Your doctor telling you, oh, madam, we're sorry to say you have cancer, but it's not the end of life. It should not bring an end to your fertility
Journey.
dreams. Yes, there are options that can be taken, to still preserve your dreams of having your own family.
Mm.
So it's not the end of life. Adhere to whatever counsel your doctors give
Give
you.
you.
Go through the treatment. I know that there's always more so if it was detected early. That's why early detection is very key in
Important.
cancer management. When it's detected early, we're thinking of a cure, but when cancer is detected very
Late.
much later, just thinking of how to palliate and so on. So early detection is very key. And for cancers that we have screening tests available, please avail yourself. Cervical cancer can be screened for. Breast cancer, we have self-breast examination for
Examination.
women above the age of 40. Mammograms, having yearly mammograms is also very helpful. For men, prostate cancer
Definitely.
can be screened for. Do your prostate specific antigen. So those are some of the ways that we can catch these things early so that they can be treated appropriately.
Like we always say, prevention is better than cure.
Yeah.
It's important that these things are caught up early and treatment starts in good time, or even if treatment does not start in good time, they are picked up early. And well, treatment, like I
Should
said,
start,
treatment
yes.
should start
Start as
early
much as
as much
possible.
as possible. Thank you for staying tuned. We're yet still pondering on what we've discussed.
Africans cancer. Nobody.
So we'll see you again next time on the show. Bye for now.